Hello, I'm Lindsay Sanders. I'm your Germana nursing student for this afternoon. I'm going to close the door to provide patient privacy and wash my hands. I'm here to do a newborn assessment on your baby. This should take about 15 minutes. Is that all right? Very good. All right, so we've already gotten the APGAR score for your baby, which was within defined limits. We have the weight and we have the vital signs. Those were all within defined limits. I'm going to inquire about the birth history of this baby. Was she born vaginally or via cesarean? Okay, and was there any birth trauma associated with that you'd like to inform me of? All right. So with that, I'm going to demonstrate how I would take the vital signs. If I was going to do them right now, I would take her axillary temperature, and then I would assess her breathing to make sure her chest is expanding equally bilaterally. I would go ahead and assess the apical pulse after I take the breath rate. For a full minute, I would listen with the bell of the stethoscope, and I would note that there are no murmurs and that there is an irregular heartbeat, because this is common in newborns. I'm going to take her breath sounds also while I'm here. Okay, the front, the sides, the back as well, and I gotta note that those are clear. I'm gonna take her length from the top of her head to the heel of her feet, of her foot, and her head circumference around the widest part of her head. Then I'm gonna take her chest circumference around the nipple line, and her head circumference was slightly larger than her chest circumference, and that is within defined limits. Your baby appears symmetrical. All of her limbs are present and intact. Her skin is intact. There's no bleeding, bruising, or breakages. Her skin color is appropriate for ethnicity, and it is warm and dry. Her mood right now is an active alert. She's a little bit fussy and a little bit moving around. I can see that her cry is strong and not weak. She has full range of motion and full muscle tone, and her body is well aligned. She is safe and warm and dry. I'm now going to assess her head in detail. I see that she has hair upon her head. This is a common finding in newborns. And I see that her head is symmetrical, her face is symmetrical, and there's a little bit of molding from her vaginal delivery. Her anterior fontanelle is a diamond shape, and her posterior fontanelle is a triangle shape. Both of these are flat. Neither one is distended nor depressed. There's no caput succedaneum, which is edematous swelling between the periosteum and the skull, and there's no cephalohematoma, which is bleeding on top of the skull. Both of her eyes are present and symmetrical. They are a light bluish gray color, which is common in newborns. I'm going to check them for pearla, so the pupils are equal round and reactive to light with no accommodation. And there's a little bit of strabismus noted, as her eye muscles have not yet become accustomed to life outside the womb. Her conjunctiva is clear, and there's no signs of inflammation or abnormal drainage. Her ears are both present, neither one is missing, and they are flexible. The tops of the ears aligns with the outer canthus of the eye, and that is within defined limits. Her nose is symmetrical, and both nares are patent. Babies are obligate nose breathers, and she is breathing through her nose. I'm now going to wash my hands and don my gloves. I'm going to feel inside of her mouth. Her palate is intact. There's no breakages, no openings. There are no Epstein pearls, which are little white calcium deposits in the mouth. These are harmless. Her tongue is present and intact, and her membranes inside are moist and pink. I also note that her sucking reflex is intact at this point, and I could observe that her swallowing reflex is also intact when I observe her feeding. Now I'm going to take my gloves back off again and wash my hands. Moving down the neck, the clavicle bones and the shoulders. There are no protrusions, no breakages, and no broken bones. They are symmetrical. Her chest is not barrel-chested. It's not protruding and is not intruding. Her nipples, there are 2 of them. There are no extra nipples. They are not engorged, but the 2 nipples are intact and present. Her breathing is again equal bilaterally. Her abdomen is not distended, and I'm going to assess for normal active bowel sounds at this point. Okay, so I do hear those normal active bowel sounds. Her umbilicus is not dry or infected, and I can still see the 2 arteries in one vein as she has been born very recently. Okay. I don't see any vernix caseosum on the skin, which is a white cheesy-like substance that could be found in the folds of the skin. This helps with skin integrity and moisture. I don't see any milia, which are small white spots on the face, mostly found on the face, but can be found elsewhere. These are harmless and will go away. I don't see any petechiae, which are small red spots across the baby's body. These would also go away and are harmless. There's no erythema toxicum, which are red blotches across the skin, which would also be harmless and go away. And I do not see any Mongolian spots, which are purplish blotches that are non-blanchable. These would be documented if present, so they won't be confused as bruises. There is also no lanugo, which is fine hair across the baby's body. This would be normal if it was present, but it's also normal for it not to be there as she's full term. I do see that she does have hair on the top of her head, though, and that is a common finding in many newborns. Okay, I'm going to assess her genitalia. This is a girl, so she has her labia covering her clitoris, and there's no abnormal discharge. If this was a male, the meatus would be on the tip of the penis, and the testicles would be descended, and the rugae would be on the scrotum. Checking her hips for dislocation, I'm going to bring them up and out and back down and together. I don't hear any hip clicks, so her hips are not dislocated. There's no foot clubbing. She has all 10 toes and all 10 fingers. There are no extra fingers or missing fingers. And I did note her eye color was a light gray. At this point, I'm going to flip the baby carefully over onto her back, supporting her head, and I'm going to assess her spine. There are no abnormal curvatures. There are no openings. There's no breakage through the skin. That is intact. It is straight and aligned. Her anus is patent, and her musculature is functioning. Has she had a regular voiding and elimination pattern? Okay. And has she passed her first stool yet, which is known as the meconium? We'd usually be looking for like a black tarry substance, but it's also normal to be other colors. Okay. All right. So she definitely has a good strong cry at this point. I'm going to assess her trunk incurvation reflex by running my finger along one side of her spine, and her spine will curve towards the stimulated side. Her Moro reflex, I'll drop her swiftly towards the table, but not onto the table. Her arms will fling out, and her legs as well, and then they would come back into the center. That is intact. Her stepping reflex, I would place her feet gently on the examination table, and one leg would flex outwards as if to take a step, and as that one comes forward, the other one would then come forward in turn, and that is present. I'm now going to assess her rooting reflex, as we've already talked about the sucking and swallowing. So I'll brush one side of her face, and her head will turn to that direction. That is intact. Her Babinski reflex, I will make it upside down J-shape from the heel of her foot to the ball of her foot, and her toes are going to flare outward. She has a positive Babinski, and that's within defined limits. Her palmar reflex. I'll place my finger in her palm, and her fingers will curl around my finger. Similarly with the toes, I'll place my finger below her toes, and her toes will curve over my finger. Those are both intact. Her tonic neck reflex, as I turn her head to one side, that arm and leg on that side will extend, and on the other side they will flex. We can test that on the other side as well. Okay, that is intact. And now I have done the Moro, the Babinski, plantar palmar, trunk and curvation, tonic neck, stepping. Okay. And there was a bit of molding on the head from the vaginal delivery. All right. Do you have any questions for me? Okay. At this point, I would offer to change her diaper, and if I did that for you, if you accepted, I would weigh the diaper. I would note the consistency and the color of the excrement or urine, and I would clean and dry the baby and put a clean, dry diaper on her and return her to you, making sure that she is delivered to the correct parents via her identification. All right, so she's looking very good, and she's off to a great start. Also, for this examination, I would definitely not have her clothes on her. I would have to remove them to see everything. Okay, so thank you very much for your time, and just give me a call on the call light if you have any questions. Washing my hands, and then I'm going to document everything that happened.